Good afternoon. You're very welcome to today's webinar, Exploring the Impact, the Programme for Government and Ending Violence Against Women and Girls. Very topical at the minute. We're going to explore evidence and research and interventions on the topic of ending violence against women and girls and the wellbeing economy, and look especially at the opportunity that we have at the minute to inform policy with the government programme for government response open for impact assessment responses, and see how we can inform those consultation responses today. We have a busy agenda, and I think you'll be really engaged and inspired by the speakers. You'll have the opportunity to contribute by asking questions, and you can add them to the question and answer box, and we'll have time at the end of the session for that. My name's Anne McCusker. I'm from Belfast Healthy Cities, and this webinar is in partnership with Queen's University Groundswell Consortium, and I just invite Ruth Hunter to provide the welcome. Thank you.
Thanks, Anne, and thanks very much for co-hosting this with us. Hi everyone, thanks very much for joining us and taking the time today to come along to the webinar and have this discussion. My name's Ruth Hunter. I'm a Professor of Public Health and Planetary Health based in Queen's University, Belfast. And it's great to see so many registered and really the scale of interest in this really important conversation, particularly around ending violence against women and girls in Northern Ireland. And it's great to be co-hosting this webinar today on behalf of the Groundswell Consortium, also with Belfast Healthy Cities. So thanks, Anne. We're going to put some information in the chat so you can find out more about the work we're doing in the Groundswell Consortium, but very briefly, the work's focused on particularly the role of green and blue spaces or public spaces for chronic disease prevention, and also around reducing inequalities in 3 cities across the UK. So this is largely in Belfast, Edinburgh and Liverpool. We're particularly interested in thinking about how we can prevent violence against women and girls in public spaces, so thinking about our parks or public transport, streets, etc. And this webinar, I think, is really timely given the recent events in Derry just a couple of weeks ago, amongst many other events and incidences that have happened that haven't made the headlines. So I'm not going to take too much time because we've got some great speakers to hear from, and also some important discussion at the end, and also how we can feed into the programme for government and the impact assessment. So I just want to finish by thanking Siobhan, Lindsay, Claire, Searing, Ciara and Louise for taking the time to come along and present to us, and I'll hand back to Anne, who's going to guide us through the webinar. So thanks, Anne.
Thank you, Ruth. So you're welcome to tweet today, and you can share at Belfast Healthy and also at Groundswell CON and at Queen's University too. The webinar will be recorded and shared with all of the registered participants and be made available on Queen's University website, and a link will be sent out early next week. I would just ask Siobhan McAllister just to come on and get ready to share your presentation. You're very welcome, Siobhan. Dr. Siobhan McAllister, Senior Lecturer in Criminology and a member of the Centre for Children's Rights at Queen's University. And Siobhan is going to speak to gender-based violence in Northern Ireland, the key findings. Thank you, Siobhan.
Okay, can you hear me okay?
Yes, yeah, thank you.
Okay, so thanks, Anne, and thanks for the invitation along today. It's great that there's so many of these events. And what I've really been asked to do today is just to give a little bit of background or overview to some of the data that we have on gender-based violence in Northern Ireland in terms of prevalence and nature. And given that the public consultation is out on the draft impact statements for the programme for government, what I've tried to do is to look at some of the data through drawing out if there's any significant differences in experiences of gender-based violence by different groups or by different demographic indicators. And I should just acknowledge my colleague, Professor Dirk Shabutz, who really helped me run all the statistical analysis on some of this data. As Anne said, I'm a member of the Centre for Children's Rights at Queen's University, and I led the research for the Executive Office with girls and young women that informed the strategy. So while I will speak broadly to some data, I'll probably focus much more on children and young people's experiences. But just to begin, if we just look at some of kind of what we have, I'm not going to go into lots of detail. I know we have representatives from different organisations today, but I guess the point is that we have fairly good data now on women's experiences of violence in Northern Ireland, ranging from our official recorded crime rates by the police, research carried out by NGOs and by academics. And while each of these have strengths and limitations, actually combined, they give a fairly good indication of the scale and nature of violence against women and girls. But there's gaps as well, as we'll see. And I think it's important, firstly, when we think about prevalence, it's important to note that the rate of this will vary by the measure. So some surveys ask questions up specifically on gender-based violence. Other surveys ask questions to women of have they ever experienced any form of violence. Some are over their life course, some are in the previous year. So we need to take care when looking at the data. But I think what's really interesting for me is that despite the different measures, actually, there's lots of consistency. And that's the key thing, I think, to pull out is there's consistency across the data sets in terms of what we consistently find is the high levels of reported violence by women. Between 7 in 10 women and 9 in 10 women across different pieces of research are reporting having experienced any violence in their lifetime. Also consistently is that this starts at a young age. Again, we have data from 12 to 16-year-olds. We have data from those specifically age 16, and we have data from adult women. So we find that not only does it start at a young age, but violence is consistent across the life course. So as I say, there's lots of different really good pieces of research. What I'm primarily going to draw on for the remainder of the presentation is the data from the Northern Ireland Life and Times survey and the Young Life and Times survey. And the reason I'm doing that is because these are representative surveys that use random samples. The Northern Ireland Life and Times survey is a random sample of over 1,000 adults across Northern Ireland who are 18 plus, and the Young Life and Times, a random representative sample of those aged 16. So this is important because it allows us to look at significance. And I'm not a statistician, but I think often when we look at data, what we can sometimes see differences in percentages, but actually we don't know if those are significant. So there's the ability with the Life and Times data to run tests of significance to see if those relationships which appear to be in the data actually have any weight to them. And again, the other value of the Life and Times data is it asks specific questions on gender-based violence. So both of the surveys provide a definition of gender-based violence, which mirrors the definition used within the strategy. So I want to begin by looking at adults. This is our most recent data from the Life and Times, the Northern Ireland Life and Times survey, so adult women. And what we're looking at here is gender differences, so reported experiences of gender-based violence over the past 5 years by those who identify as men and those who identify as women. What I've highlighted here are the findings which are statistically significant. So what we see here is that 24% of women, so 1 in 5 women, as opposed to 16% of men, had experienced some form of gender-based violence in the past 5 years, and that's statistically significant. Particularly noteworthy and also statistically significant here is that women were over twice as likely to experience sexual violence. None of the other findings here are statistically significant. We don't see huge changes. And I think this is interesting in its own right. But when we start to look at the young people's data, we actually see differences here. So it reminds us of the importance of looking at age as a factor in experiences of violence. What I wanted to do then was, again, as we say, given that we're thinking about the impact assessments and the equality impact assessments, was to look to see within that female sample, are there any discernible differences by different demographic factors or social characteristics? And again, what I'm just doing is I'm reporting just the statistically significant findings here. Again, if you just look at the tables of results, it may look like there's differences in the percentage levels in the raw data, but actually they're not all statistically significant. In terms of disability, what is significant is that a lower percentage of females with disabilities than those without disabilities report not having experienced any violence in the past 5 years. So from this, we have a very strong indication that women with disabilities are exposed to higher levels of violence, of gender-based violence. In terms of rurality, again, differences initially do appear when we look at the data between urban areas and rural areas in terms of reporting of gender-based violence. But actually, when men are excluded from the sample and we just look at women's experiences, those differences lessen. So there are small statistical differences in the data here, in that women in urban areas appear to have higher exposure to gender-based violence. They report experiencing higher levels, particularly of sexual and psychological violence. But we do add caution here that this is statistically significant at a fairly low level. So for us, we think the general message to take from the data here is that adult women have similar experiences of gender-based violence wherever they live. In terms of some other social characteristics, sexual orientation, race and ethnicity, unfortunately, we don't have high enough numbers within the sample to run the data by individual groups. But there is other data here, particularly WRDA's policy group research has some excellent qualitative data on the experiences, for example, of gender-based violence by transgender women, of the very particular experiences of migrant women. So I think there's some messages for us here in terms of places where data might be missing, but actually that some groups, in order to look at the intersection of gender and other identities, that qualitative research might be most effective. What we do see, and what I think is probably one of the key findings when we start to look at differences within the female sample of adult women, is actually the difference by age, how experiences of violence vary by age groups. So within the survey, there are 6 age categories, 18 to 24, and then 5 categories, which are 25 upwards. And because the recorded experiences of some forms of violence was so low in some of those categories, we've had to just make an overall 25 plus age group in order to run statistical tests. And what we see very, very clearly here, and these are all statistically significant, highly statistically significant, is that younger women, those between 18 to 24, report higher levels of all forms of violence. In fact, they report very high levels of some forms of violence. 40% had experienced psychological violence in the past 5 years. 37% had experienced sexual violence. Again, 37% had experienced online violence. And again, the point is that this is at much of a higher level than those of any other age group. I think we see it very well in this bar chart. This is a question which asked all the age groups, to take, I've experienced no form of gender-based violence in the past 5 years. And this really highlights the difference between the 18 to 24 age group and every other age group, that they're much more likely to have reported experiencing some form of violence. So again, we do note caution with these sorts of statistics. They could reflect a number of things. Certainly, it appears that younger women are experiencing violence at a much higher rate, but also this could also be that younger women have a higher awareness of gender-based violence, or that they're more likely to report gender-based violence than older women. So it's just about being careful and taking these factors into account when reading the data. So I think the big message is when we look at the data from women, those 18 plus, are some differences in disability, in that those who have a disability are more likely to experience gender-based violence generally. Women are more likely to experience it than men, and the youngest age group of adult women appear more likely to experience it than other age groups. I want to move on to look now specifically at children and young people. We know it's important to look at children and young people for a number of reasons. Again, there's a child's rights impact assessment, so this may be particularly relevant in thinking about that. But we've already seen how age intersects with gender in terms of experiences of violence when we looked at the adult sample. We're now looking at those under the age of 18. Obviously, also from a rights perspective, the United Nations Convention on the Rights of the Child recognises the devastating impact of violence on children's lives in the present, but also in the future in terms of their future development. And while Article 19 of the UNCRC outlines states' obligations to protect children and young people from all forms of violence, it's well recognised that actually violence against girls prevents the fulfilment of all of their rights. Rights are indivisible. The impact on one right will impact protection and provision of other rights. It's also noteworthy that the UN Committee on the Rights of the Child, in their most recent examination of the UK state's compliance with the UNCRC, noted their concerns about the high prevalence of domestic abuse, sexual exploitation, gender-based violence, and other forms of violence against children. So it's really important that we look at this from a child rights perspective, but look at the intersection of age and gender. There's a link to the report in the slides that I think Anne will share afterwards. This report was, as I said, commissioned by the Executive Office to look specifically at the experiences of girls and young women aged between 12 and 18, and then extend it from 18 to 25. And very clearly, we see specific experiences. What we've seen is that young women had their understanding of violence was different. They didn't appear to learn a great lot about violence within schools. Because of unequal power relations, they were vulnerable in a different way to adult women to violence. They also had very particular experiences of violence and very particular barriers to reporting. I'm just going to say a little bit about the Life and Times data and come back to the report shortly. This is the 2022 Life and Times data. So this is 16-year-olds in Northern Ireland. And this is reporting of lifetime gender-based violence by 16-year-old boys and girls. And what we see, I think, reflective of decades of research here, is that boys are more likely to experience and to report experiencing physical violence, and girls are more likely to report experiencing sexual violence. Here we see that 43% of girls reported unwanted touching, hugging, or kissing, compared to 26% of boys. But for me, the value of these sorts of questions is that they move beyond what might appear quite narrow definitions or categorizations of violence, and they include a whole range of harmful behaviours that young people might not initially identify as violence. They might not be traditionally defined as violence. So here we see things that include, face-to-face, in-person violence. We see verbal abuse. We see different types of coercion and aggression. We see intrusive experiences, unwanted, unconsensual sexual experiences in person and online. There's a couple of really, stark things that we see from this. Is that when we look at all of these forms of violence, girls are more likely to report experiencing almost all forms of violence, apart from physical violence and verbal abuse. Also, I think what's really quite telling here is not only do they experience various forms of violence, but they're in various settings. So high levels of violence in private places, in public places, and online. So this really moves us to think about where violence happens for young women, and that it might be in similar but also different places to adult women. What we see here, 75% of young women reported experiencing street harassment, 67% inappropriate staring, and 52%, so 1 in 2 young women, had received an intimate photo or video without consent. If we move on to look at the most recent Young Life and Times data, so this is just launched recently, the 2024 data. Again, what we're looking here, so instead of lifetime prevalence, what we're looking at here is reports within the past year. So what we see very clearly from this is that girls and young women are about twice as likely to experience reporting any form of gender-based violence in the past year. So 4 in 10 young women had experienced some form of gender-based violence in the past year, compared to 18% of young men. What we also see here is that there's differences in the types of violence that they're experiencing, which is, again, this is different to the adult data, which wasn't statistically significant. All of these findings are significant. So what we see here, for instance, is that young women are almost 6 times more likely to report experiencing sexual violence, and they're almost 3 times more likely to experience psychological and online violence. So very different from the adult sample, but we see very big differences here in young women and young men's reporting of gender-based violence. So what then, when we look within groups, when we look at young women, 16-year-olds, what do we see in terms of some of those demographics or some of those social characteristics? Again, we're only reporting the statistically significant findings here. Rurality does appear to be significant, but only at one level, whereby young women from rural areas were more likely to report that they had no experience of any form of gender-based violence in the past year, as opposed to young women living in urban areas or in small towns. That was the only statistically significant point there. Again, we have to be careful in what we take from that. This could also, be reflective of where violence happens. It could be reflective of understandings of violence, willingness to report in different places, but some interesting findings there. Unlike the adult sample, we do have a proxy measure for sexual orientation within the Young Life and Times, which we've recoded into same-sex attracted females and opposite-sex attracted females. And all of these findings actually were highly significant, which means we can be quite confident in the relationships that appear to be shown within the data. What the data showed was that young women who were same-sex attracted were much more likely to experience all forms of gender-based violence than those who were opposite attracted females. And what's interesting here is this was also physical violence. So again, different from the full sample of young women who are same-sex attracted actually are experiencing higher levels of all forms of violence. In particular, they were almost twice as likely to experience online violence. 41% of them had experienced online violence, compared to 21% of opposite sex attracted females. And they were also much more likely to experience psychological violence. Race and ethnicity, again, the numbers here were too small to carry out any analysis on. And I think, again, the fact that this keeps coming up, that we're lacking data on this, alerts us to the fact that we need to look at this in more detail. So if there's going to be research around, the intersection of race and gender, we need to add age as another factor in there. That there might be particular experiences of young women here as well. For me, one of the most stark findings when we looked at the data was in relation to young women with disabilities. So again, we have categorized this into those who reported having any disability or long-term illness, and those who had reported no disability or long-term illness. And all of the findings here were statistically significant and highly significant, again, meaning that they're very robust in terms of what can be drawn from them. What we see here is that young women with disabilities report higher levels of all forms of gender-based violence than those without disabilities. They were 4 times more likely to experience physical violence, but also experienced high rates of psychological violence and online violence. So again, this really underscores the importance of examining not only the particular experiences of young women, but those with intersecting identities. Again, there's need for further research here, I think, in terms of understanding this further. I think actually the Executive Office might be planning to do some research around the issue of gender-based violence and disability. But this is one area where there appears to be something we need to look into. And what I just wanted to end with was to be thinking a little bit about place and space, given that this is, a Healthy Cities event, and we're, interested in looking at public spaces. The Young Life and Times, for the first time in 2024, asked young women and young men where they experienced gender-based violence. And there's some interesting findings there. Again, all of this data is publicly available on the ARC website. Interestingly, 29% of females compared to 14% of males reported experiencing violence in public outdoor spaces. So it's again, kind of reflecting some of the data that we had showed at the very beginning in terms of things like street harassment and the number of young women that reported experiencing those. Another interesting and quite surprising finding in some respects, but perhaps not, when we speak to young women qualitatively, is how young women and young men report their feelings of safety within public spaces. And this, I say, the findings here very much reflect the qualitative research that we carried out, and I'll show you some quotations of that from that shortly. But what we see very clearly here is the high levels of young women who report feeling almost always or mostly unsafe in public spaces. Almost 50% of young women felt unsafe on public transport on their own. And this was 7 times the amount of young men who felt unsafe on public transport on their own. We also see very high levels of 30%, a third of young women feeling unsafe in quiet streets near their home, in a park or in an open space, and again at much higher rates to young men. But also of interest here is it's not just quiet spaces and it's not just on their own. 43% of young women reported feeling unsafe in busy public spaces like high streets and towns. And as I said, this very much reflected the qualitative research that we carried out with young women for the Executive Office, in the research particularly with 12 to 18-year-olds. Very much within interviews and focus groups, they talked about these everyday instances of sexism, harassment and abuse, which ranged from like intimidation, stares, verbal harassment, verbal sexual harassment on the streets, and unwanted touch. And there's lots of examples here. This is just a selection of quotations here. So this would have ranged from things like grabbing, groping, to pressing if you're on the bus or something and you have to move yourself out of the way. So again, these everyday experiences that the young women actually themselves didn't at the beginning define as violence. But what we see is that they did talk about place a lot. Buses featured quite a lot, streets featured quite a lot, but anywhere in the street, in the park, in towns. And the final quote at the bottom, I think, is also interesting. It wasn't just when young women were on their own. They could be in a big group of people and you walk through a big crowd and they just touch you, and it can happen anywhere, anytime. These experiences were so routine, so typical for the young woman in the research, that they initially often didn't define them as violence in their discussions, because they happened all the time. They happened in all public places and they happened to all young women. So there was nothing significant or special about their experience, which is why it led them to believe that this form of violence was something that just happened. But of course, we know that it's these everyday forms of violence that contribute to the broader culture of harm, where other forms of violence become possible, become anticipated, and become tolerated. I'm sure Claire will go on to talk about the delivery plan for the Ending Violence Against Women and Girls strategy. But for us, I think it's so encouraging within this to see the deliberate focus on prevention, including awareness raising campaigns, education and training, with a view to challenging those attitudes, behaviours and cultural norms that really enable violence against women and girls. I'm just going to end with this final slide, because I think it reminds us of the need for that level of prevention and that level of education. All of the data that we've looked at shows the high levels of violence that women and girls, the high levels of gender-based violence that women and girls experience, and which they experience disproportionately. But this is again from the Young Life and Times survey. When young women and men are asked if they think violence against women and girls is a problem or is common in Northern Ireland, less than a third of young men thought it was a problem. So this really does tell us something about the need for education, and the need to bring boys and men along with us. And I think I would be doing a disjustice to the young women in the research if I didn't make the point clear that they kept making, is that they didn't think that boys often knew the impact or the harm that they were experiencing, that sometimes they thought things were a joke, that it was almost unconscious, that it was routine practices. So the fact that the delivery plan has got lots of work in there in these first 2 years about disrupting some of those routines and practices and cultural norms is really important. Okay, I'll leave it there.
Thank you so much, Siobhan. I think that was very thought-provoking to see the evidence and what's happening currently in Northern Ireland, and the need then for, an approach. And I know we will talk about the delivery plan that includes education and awareness, but also interventions, and who all needs to be part of the solution to take practice forward. And I think we have a key moment in time where we can inform the programme for government and highlight the issue that exists and the need to do continued work around this. So thank you so much for sharing your research with us. I would encourage anyone to add to the question and answer box if you have questions for Siobhan and her presentation. There is a link in there to the Groundswell documents, the website, and you will be able to receive that link as well in the email that goes out to all registered participants next week. I would like to welcome our next presenter, Lindsay Fisher. I'll ask you just to get ready to share your presentation, Lindsay. Lindsay has been in the police for almost 23 years in the area of public protection, working initially in child abuse and rape inquiry units, and then as a deputy sergeant in the rape crime unit, and then as a deputy inspector in domestic abuse and offender management. Since 2020, Lindsay has held the portfolio as organisational lead for domestic abuse, serious sexual offences, and latterly ending violence against women and girls. In 2022, Lindsay had the privilege of receiving the King's Police Medal for her work in the area of domestic abuse. You're very welcome to the webinar. Thank you so much for joining us, and we look forward to hearing your presentation. Thank you, Lindsay.
Thank you. And I'm just checking that you can hear me, because I know I had some technical difficulties.
Yeah, we've had some today, but I can hear you perfectly.
That's great. So
You able to share your presentation? Would you like me to?
I don't think I'm going to be, I'm not sure whether I'm going to be able to or not, but I'm happy to share it afterwards and share it amongst the group. So I'm happy to, I suppose, to chat through, I suppose pick up actually on some of the previous points as well. Just I suppose to bring that extensive research into what we see in a practical sense in terms of policing. And I think for me, it's really important just to take a moment to reflect on exactly what has been happening in Northern Ireland, not just over the last number of weeks and months where we have seen the absolute horror of the impact on violence against women and girls, where a number of women, where 4 women lost their lives in a 6-week period, where we see repeated reports of sexual offences in Derry City and Strabane over the last number of weeks as well. But actually to reflect on each and every woman that and girl that has been impacted in this area. And sadly, there have been such a significant number. And whilst I will touch on some statistics in terms of what does that look like, I think we can't continue to, from a policing perspective, to look at statistics, because whilst crime is down, whilst Northern Ireland statistically is and this is obviously based on stats that are reported to police, statistically crime is down, as by what's reported to us. It's about the perception and the feeling of safety. And having been in Strand Road over the last number of weeks, there is a feeling that there is a lack of safety for women and girls. So I think it's dismissive, or it appears dismissive of me to speak about the fact that in actual fact, we see around 15% of a decrease in the violence against women and girls statistics that have been reported to us. And whilst some might say, does that reflect a crisis in confidence in policing? And I don't think it does. And I suppose I just want to reflect a little bit on why we see that decrease. Some of that is down to Home Office counting rules in terms of how we now record crimes, where we still investigate the crimes that are reported to us, but in terms of the counting of those crimes, we look at the most criminally severe and we count those. So that has an impact overall on the number, but actually there's a significant amount of work has been undertaken in the prevention space, in those opportunities to intervene before crimes happen. And some of that is in working with our key partners, whether that's in the nighttime economy, whether that's in the safer spaces through Ask for Angela and through the work that we do with ONUS. But actually, I think it's also about making sure that our officers and staff members who are on duty, who are answering calls, who are responding to those calls for service, understand what they're looking for, not just in terms of the calls that they answer, but actually whenever they are on patrol, not answering calls, whenever they are going about their patrolling. I think it's really important that we have spent a significant amount of time working with officers to understand the predatory behaviours that might be shown before an offence happens, and actually to encourage those opportunities to intervene. And this is really timely today, because actually just this morning we had our first session with Graham Goulden, who has been undertaking a programme of work and developing that with myself as to how do we roll out that active bystandership across PSNI, and how do we have those conversations, whether it's about our internal conversations that we have with one another and we challenge that inappropriate joke, that inappropriate or comment that is made, or whether it's about our interaction on our criminal investigations. And I'm not just saying this because I was involved in ensuring that this training was undertaken, but I was so overwhelmed with the level of participation in the first session, and the feedback has said the same, that we rarely see the level of interaction and engagement in online sessions that we had this morning. So we have 3 more sessions across the rest of the week, and some other sessions to be organised in December alongside our Train the Trainer, which will equip internally our trainers to really take that practice and not just deliver it in the bespoke training around violence against women and girls, but actually take those principles of what it means to be an active bystander to all areas of policing, which I think is really, really important, because we see those microaggressions, we see those gaps in policy and procedure across so many different settings, albeit obviously our focus primarily for the training package is around violence against women and girls. So I suppose I just want to reflect a little bit on the journey that policing has had over the last 3 years. We are now, and I can't believe it has gone that quickly, but we now are in year 3 of our action plan, which sees us, as the media had indicated at the time of the launch, us taking that 4P approach. But I'll reflect just a little on what happened in our first 2 years, and everyone on the call will be only too aware as to why we needed to take action, why we needed to have a PSNI version of the National Police Chiefs Council Violence Against Women and Girls action plan. And since that time, since that launch on the 27th of September 2 years ago, we've seen out of our 41 actions that we set ourselves, we were holding ourselves to account, we have delivered against 33 of those. As I said, we've seen a 15% decrease in reported violence against women and girls, and there have been hundreds of targeted neighbourhood patrols across the country. In terms of criminal justice, being a police service, of course, that has to be our focus. During this time, we've seen over 3,000 arrests for the domestic abuse offence, for stalking and for non-fatal strangulation. We've seen a significant number above that in terms of other offences, but that was really just focusing on the 3 new offences that we've seen in the last mandate, and that is through the Domestic Abuse and Civil Proceedings Act, through the Protection from Stalking, and through the Justice Sexual Offences and Trafficking Victims Act. So I think the fact that we've seen so many arrests in that first 2 years, really, and some of those offences only went live in the second year, that shows that policing is embracing the new legislation. We want to have those new tools in our toolbox, because for too long we have been going into houses knowing and feeling the toxicity, feeling the abuse, but actually not having the tools to deal with it, not having the legislative parameters to step in and do something about that. So I think the fact that we saw somebody in court within the first 72 hours of the non-fatal strangulation legislation going live, charged with that offence within 3 days. We saw the domestic abuse offence being used within the first 24 hours, and similarly, the stalking offence within the first 7 days. That shows that police are committed to violence against women and girls, and to make sure that this is a safe community for the women and girls across Northern Ireland. And actually, we want to use all of the full forces of the law to better protect. And actually, whilst of course we speak about the women and girls in this setting, but actually for me it's really important to hold a mirror up to each and every perpetrator that commits those offences, that does that catcalling, that thinks that it is okay, acceptable, or that they won't be challenged whenever they behave in that way. We've had thousands of officers trained to better recognise and to be able to better respond to violence against women and girls, whether that is about our new legislative parameters with 6,000 officers trained to understand and identify the signs of coercive controlling behaviour, over 4,000 to identify stalking, and over 2,000 to identify those offences of non-fatal strangulation. And I think the fact that our arrest and our outcome rates, particularly for those offences, show that that has been time and effort well spent to make sure that we can equip the officers that are going to be patrolling, that are going to be responding. But actually, it's also it's more than that. It's more than just thinking about the figures, the numbers, and what we have done. It's also about thinking about our response to key partners, to our response to our officers. And one thing for me, I think was really crucial during those first 2 years was launching our domestic abuse in the workplace. It's really important that we have a focus internally and we're setting those standards, that we see those perceptions that people in positions of power will not be held to account, whether that is that they are a police officer, a police staff member, that they won't be held to account for their behaviour. I wanted to make sure that everybody knew internally that that was not the case, and that mirror would be held up regardless of who that person is. And we've also seen during that time our service level agreement on our investigations with the Public Prosecution Service. Again, another really timely and important factor whenever we think about investigating and prosecuting domestic abuse offences. And we'll see our first quality assurance on that new policy in the new year, 6 months after it launched. So that's our I suppose, our reflection on what we achieved in the first 2 years. But that's not to say that there's not a significant mountain still to climb. Otherwise, I wouldn't be in the media talking about women in the past tense. We wouldn't have to do that. Events like this wouldn't be needed because we would have addressed all of those concerns. And sadly, we're not there. So to reflect on what happens next, we did completely overhaul our action plan. And I think it was timely. We knew that what we had was going to be our first 2 years because there were certain things, processes, and obviously in our last presentation we spoke at length about data collection. And we've spent a significant amount of time collecting that data, creating a baseline to better understand exactly the challenges that women and girls face. But now, looking forward for years 3 to 7, the lifetime of this particular action plan, we are using the UK model around terrorism, serious and organised crime, to make sure that we are thinking about it in those terms, because it has a similar but different impact. It is 21%, over 21% of our investigations, of our demand in terms of policing, and that's actually just focused on domestic abuse. It's 21%. Whenever we take in all of the other types of offences and abuse that women and girls are impacted by, it's likely closer to 30% of our demand. So our theme then are under the 4P approach, very similar to the EVOG, to the Executive Office, and very similar, of course, to the Istanbul Convention. Our theme, one, is to prepare policing in the fight against violence against women and girls. Theme 2, to protect communities from violence against women and girls, to pursue violence against women and girls perpetrators, and to prevent people from committing violence against women and girls. And whenever we think about preparing the organisation, that's to effectively respond and reduce violence against women and girls, the foundation of our readiness to tackle, to make sure that we are fit to serve, thanks to the right culture, skills and resource. And I think that goes back to our conversations with Graham Goulden this morning, and understanding that people know that it is not okay. It is not okay to have that inappropriate joke, that inappropriate comment, to think about women and girls in that space, and actually to give them the confidence to step forward. And as we have had a new chief constable in the lifetime of our action plan, that one of the first things that we undertook was a new statement of intent, which really just reinforced the vision for Team PSNI and what we would and would not stand for in our fight internally and externally against violence against women and girls. We are continuing with our vetting structures to make sure that they are fit for purpose across the organisation, whether that's before you become an officer or staff member, or whether that's in service, or whether that's whenever you are applying for particular and bespoke roles across the organisation. Whenever we think about protect, of course, it is the police's role to protect, to step in whenever those crimes have occurred, and we will use the full rigour of those powers that are available to us. This is about protecting individuals and communities from violence against women and girls and the harm that that causes. This P obviously will focus on the victims and their needs. We will keep victims, witnesses and communities safe and their needs and direct the balance in terms of our police response. And that's where we are undertaking that work with Graham and others to make sure that we understand that thematic problem across all crime types whenever we think about violence against women and girls. We still, as I said, have a significant mountain to climb, and that's no more so whenever we think about some of the new provisions that we haven't yet been able to achieve, whether that's in working with the Department of Justice around our operationalisation of the domestic abuse protection orders and notices to make sure that whenever they are introduced, that they are fit for purpose, that we have the ability, the resource, the training, the funding to be able to support women and girls in their application for those. But also to actually engage more with victims, to see and understand their experiences with police, but also with the justice system. And we're going to do that through our development of a rape victim survey, but also through our consideration for scrutiny panels. And I think that's a really key area to hold that mirror up to ourselves, to think about what has worked well, what hasn't, challenge ourselves to, could we do more? Could we do something different? And that is a long-term plan in terms of a scrutiny panel. I don't believe that will be something that we're able to introduce in years 3 or 4, and it is more likely to be in the second half of our mandate, essentially in our action plans, years 3 to 7. But I think the fact that we are working with our key partners to make sure that we can do that, we can work with individuals and organisations to understand why cases aren't going to court, why, and actually really develop and change our processes. I just want, conscious of time, so I just want to focus a little bit on our work with our partners, and that's really across our final 2 themes. We have been working with a number of partners in this space, whether that is about our Ask for Angela, which is across over 350 hospitality outlets across Northern Ireland, or whether that is working with our continued partnership with the Department of Justice through our domestic homicide review or reviews to make sure that they are fully embedded, or our other non-statutory or voluntary sector partners, Women's Aid, Nexus, and all of the other key partners that we work with to make sure that our training and our policies and processes are fit for practice, and also to work with our police forces across the UK, like Thames Valley, for example, where we will see Operation Vigilant come in across Northern Ireland in coming months, which really again focuses on those perpetrator behaviours that we can intervene at the earliest opportunity. Thank you.
Thank you, Lindsay. And I mean, we could talk about this for much longer. I'm sorry you had to squeeze it into a few minutes. I think it's crucial what you're saying around the stark reality of violence against women and girls and the impact that it has on each life that's affected, each family and communities. and then how that affects perception of safety. And we've heard also from Siobhan about the research in terms of where young women and girls feel safe and not safe in terms of public spaces and public transport, and the ripple effect that that has on our lives. So it is really important to have that internal culture change as well as challenge behaviours and conversations at that earliest stage. So thank you for joining us. There are some questions in the chat and we'll get to that. I want to welcome Claire Archbold. Claire is the senior civil servant and a barrister with a 20-year civil service career. She leads the cross-executive strategic framework on ending violence against women and girls, and was previously the deputy head of the Departmental Solicitor's Office. Claire, there is a wee bit of noise in the background. I'm not sure if you can hear that too. Yeah.
I'm going to close my window. So
okay.
if you hold on and we'll see if that works.
I'm going to share your slides here and see. There we go.
There we are. Is that better?
Yeah, I can hear you. Yeah, go ahead.
Great.
So I'm happy to go with your slides. Go on ahead. Thank you. You're very welcome, Claire. Thanks for joining us today.
And it's lovely to be here, and thank you. And you'll see that I am disguised as Julianne Brownlee and Jane McCarthy, who are two brilliant members of my team. But I'm here to talk about the strategic framework. Next slide, please, Anne. I'm going to touch on the Ending Violence Against Women and Girls framework, first delivery plan, how we're going to do this, and the opportunities of being a priority in the programme for government. Now, because I'm speaking to an audience of researchers, I really want to go back to where we started, which was a foundation of international and local best practice. We had wide engagement with academics working in the area, some of whom are on the call today, and thank you for all your input. We did an international review of promising practices, a literature review on key themes. We reviewed local research, and that also means the gaps in local research. We looked at the government data sources that we can use, both to interrogate it, to disaggregate it, to join it up, and to think, how do we use this to actually measure change, measure a baseline and measure change. We commissioned qualitative research from lived experience through two teams, one led by Susan Lagman at the University of Ulster, and one led by Siobhan McAllister, who has just spoken to you and given you a flavour of that research. And really the value of that is absolutely inestimable. And we have seen that research. It's on the TEO website. We have seen it being quoted by MLAs in the House, by committees, being quoted by people who were responding to our consultation and really informing the public debate, which is what you want. And we also worked with the ARC, with Dirk Shibboltz and his team, to commission modules in the Life and Times surveys, both for adults and young people. And that, again, is on the NISRA website. It's really worth looking at and seeing. We're trying to use NILT and YILT, not just to baseline experience, but to baseline attitudes, so that we've got something that we can measure going forward as we try to change two things. We try to change prevalence and we try to change attitudes. Next slide, please. Now, what's our theory of change? We have found the gender-based violence pyramid as a really helpful way to think about what we're trying to do here. You'll know the pyramid model. You'll know that the elements of violence against women and girls are seen as layers in it. We know of all the good work that is already happening at the top to tackle the criminal offences, and Lindsay has just outlined some of it and the very real impact that that has. But we're not going to get rid of, and that's the title of the challenge that government set us, to end violence against women and girls. We're not going to do that unless we get down to the lower layers of the pyramid. We look at the unwanted behaviours. We look at the damaging attitudes and beliefs that we all live with. We look at the systemic inequalities and the damaging social norms that those are creating. Now, while the Ending Violence Against Women and Girls strategic framework needs to encompass the full range of actions on this type of violence, abuse and harm, our focus, and our co-design partners concurred with us, was that the focus should be on prevention, changing the attitudes and beliefs which give rise to the unwanted behaviours and create an atmosphere in which violence can flourish. You'll see our problem statement, which our co-design partners developed with us. That's what we're trying to do. We're trying to change not just the behaviour, but to change the culture. Next slide, please. So the strategic framework was launched in September. You'll see our timeline on the screen, which shows the development from we started work in 2022, and really is a way of showing the input, the engagement, the co-design, the consultation that surrounded our deliberation on this issue. It's not just me saying that, but if you go to the document, to our strategic framework, and scan the QR codes, you have an opportunity there to hear from our stakeholders about how they felt about the process. We had over 50 organisations, businesses, government departments, statutory agencies, community and voluntary sector, and importantly, women with lived experience who participated in that. And we maintained an intersectional lens on everything we do. There were over 600 responses to our public consultation, over 90% of which were in favour of us moving forward with the plan as it stands. The other 10%, some of them took issue with our premise, but others of them said, well, maybe you don't go far enough, or we don't like some aspects of this, we don't think they're radical enough. So there's a mixed bag in that 10%, but 90% of people were in favour of this plan, not just a plan, but this plan. There are some statistics there which I'll not focus on because Siobhan has given you a sense of the really stark statistics that we have. One of the statistics that she gave us was on the number of young women who have received an unwanted intimate image. And in Siobhan's work, over half of young women said that had happened to them. When we went out to our youth focus groups and showed them that research, one of them said, oh, miss, it's not. It's everybody. And so that real sense that particularly among our young people, this is something that is such a big part of all of their lives. But that the way that we are trying to go out and listen to people's lives also reminds us that the lives of women and girls can't be reduced to statistics. The stories behind the statistics are stories about all of us. They're about girls and women who we know. They're our families, they're our friends, they're in every part of our lives and our communities. And recently we've heard of far too many tragic incidents impacting the lives of very different women and girls across our communities. I think it's a good place to leave this slide is on the vision. A changed society where women and girls are free from all forms of gender-based violence, abuse and harm, including the attitudes, the systems and the structural inequalities that cause them. That's an ambitious vision, but it was developed in co-design with our partners. In consultation, 94% of respondents agreed with it. It's a call to action for government and it's a call to action for our community. Next slide, please. How are we going to sort this out? Well, our co-design identified 6 outcomes across 4 themes. Those of you who are familiar with the Istanbul Convention will not find the 4 themes to be a surprise. Prevention, protection and provision, the justice system, which is a bit of an expansion of Istanbul's prosecution theme, and working better together, what Istanbul calls policy coordination. But we see it's not just in policy, it's in service delivery. And you'll see that we have 3 outcomes in the prevention space. We are trying to take a public health approach, which means that we'll focus on tackling the root causes, we'll focus on primary prevention. We need for a public health approach to work to ensure that we have information about the populations which require interventions, as well as about risk and protective factors to allow us to shape interventions and services appropriately and to measure success. Now, I'm not going to read those out because you can read them yourselves, but what I want to focus on is the types of things that will need to be done to make a start in each of these areas. Campaigning to change attitudes and behaviours. Education, which is so important to get those healthy and respectful relationships and the skills to have them, to protect the well-being of every individual, not just of girls, but of boys and men in our society as well. There's an urgent need to focus on our children and young people, supporting parents and communities as well as schools. The third outcome is one which Groundswell may feel particularly drawn to: the need for everyone to take action to make women and girls feel safe. Now, part of that is encouraging women and girls to protect themselves, but if that's all we are doing, we're not solving the problem. The remaining three outcomes relate to the other themes: protection and provision, making sure that our general services and our specialist services are consistently good and available to everyone, that there are no barriers to justice and support for particular groups, a justice system that has the confidence of victims, survivors and the public. And we're working very closely with other government agencies and with other government strategies on this, particularly with the police and particularly with the Department of Justice and Department of Health's domestic and sexual abuse strategy, which we are in lockstep with, and also with the Ending Paramilitarism and Organised Crime strategy. And finally, working better together. And that is really, that's the magic ingredient. The leadership from the top, the leadership from our ministers, the leadership from the centre, and also the leadership, the nodes of leadership in every organisation that will ensure that change happens, that we have the data, that we can measure our progress, and to see long-term coordinated action. It is a recurring theme of this talk. If this is the one thing you take away, we need a whole of society and whole of government approach to tackle an all-pervasive problem. Next slide, please. How are we going to do this? So the initial delivery plan is for 16 months. The reason for that is that it is a test and learn phase, where we are going to take strong action, which is focused on prevention and early intervention. We're going to mobilise existing sectors and to stimulate activity for later development in our next plans, because this is a 7-year strategy. The key actions now include community investment, a change fund aimed at grassroots community groups and at the expert organisations in the community and voluntary sector to get the ideas down onto the ground as those vital on-the-ground projects and responses that raise awareness, build capacity to take action and equip people to have safe and healthy relationships. We will also support technological and other innovations to improve the safety of women and girls through a £500,000 investment from the Small Business Research Initiative. Now, our call for tenders through that initiative has gone out. It has been adjudicated, and we're very pleased with the response that there has been, both from the private sector and from the social enterprise sector as well. The next theme is collaboration and innovation. Really gathering stakeholder networks in different sectors around the proposition, seeing what they can do, measuring the change that they make, sharing their good practice, using trauma-informed and public health approaches, and also taking a deep dive into specific issues together with lived experience, with service providers in the public and in the voluntary sector. So lots of collaboration, absolutely key to delivering this well. And finally, of course, communications and campaigns, so that everyone here, including our children and young people, understands the issues and knows how to help end violence against women and girls. Next slide, please. I have some more detail here about our Change Fund, which is a fundamental part of delivering our strategic framework. We're going to work in partnership with councils with 2 strands of work. Strand 1, which supports grassroots community groups to do more, building on existing work or developing new initiatives and approaches, providing people and communities with the support that they need to achieve change and to equip themselves to do that. And Strand 2 will support regional, community and voluntary sector experts to deliver tried and tested prevention. While these are being established, a momentum fund to local government will provide opportunity to take immediate action on the ground. And we are delighted to have this opportunity to work with all 11 councils to build capacity and to really embed this theme into everything that they do. Next slide, please. Campaigns, a sneak peek of some of the campaign work. And I'm sorry, Lindsay, if this is a spoiler for your campaign, but we'll be getting our message out across society, working collaboratively in development of campaigns with a range of partners across a range of sectors and integrating lived experience. The partnership working has already started through the Power to Change campaign, which is a collaboration with the police service, with DOJ, and with ourselves, which we hope is going out very early in the new year. It's focusing on the need to change attitudes and behaviours and culture, and to encourage bystander behaviour. And the reason that we have the scenarios showing active bystanders calling out unwanted behaviours or challenging men, usually men, in the justification that they have for what they're doing. We ran these past our youth panels, and they inputted into the campaign concept. One of the posters that we have chosen there, I was just DMing, I was just creeping out, are you going too far? It was the young people who gave us those words, because the words that we had chosen were a bit old-fashioned for them. But this is a call to action to challenge unwanted attitudes and behaviours across multiple media platforms. We'd like to see this supported by lots of organisations. We want to have a role in providing materials and social media and other assets to as many partners as possible. Our next campaign will be on coercive control, working with partners in the University of Ulster and the community and voluntary sector. Other areas of collaboration that we have, sectoral groups. There's a marvellous sectoral group working on safer socialising led by Hospitality Ulster. We're establishing a workplace forum led by the Labour Relations Agency, a healthy relationships forum led by the Department for Education, and work with the universities and colleges. Next slide, please. We are absolutely delighted that ending violence against women and girls is a theme in the draft programme for government. This is an acknowledgement of the seriousness of the problem and the joint effort and focus needed for change to happen. I'd like to highlight why it's significant. First of all, having EVOG in the programme for government emphasises that it's a priority for government and for all of us as society. It gives the issue a high profile and visibility. Secondly, leadership. Strong leadership is essential to create a society-wide movement and to drive change in all sectors and across our communities. We are delighted that the First Minister and Deputy First Minister have made their feelings on this subject and their support for the issue so clearly known. And I think that leadership in all organisations is absolutely key. Accountability. The programme for government provides an extra layer of accountability to make sure that we are making progress towards the 6 outcomes. And finally, it allows us to focus on ending violence against women and girls throughout government. Embedding EVOG into the programme for government ensures an additional emphasis and focus across the whole of the executive and government departments. It's another lever for change. I look forward to hearing your ideas and thoughts on this and on what you as a research community and as activists feel about the programme for government and about our work being highlighted in it and being owned in that way at the very centre of government. Next slide, please. But if I ended this by saying, well, government's going to do lots of things, I wouldn't be giving you the call to action that we need, because this has to be a whole of government and whole of society approach. This isn't just a women and girls problem, as the stand that you can sort of see behind me says. What it says is, this is not a women and girls issue, it's an everyone issue. There's something that all of us can do, and I look forward to talking to you to figure out what your role in this is as well.
Thank you very much, Claire. Again, I think that really linked very well with the previous two presentations in terms of outlining the research and the current statistics, but to see the way forward where the opportunities are and framing it as a public health issue, which it absolutely is. And again, just reiterating that opportunity to feed back into the impact assessments for Programme for Government so that it is a priority, not just a standalone issue, but a whole of government approach to the issue and looking at it in terms of the prevention opportunities and protection using that Istanbul Convention model and how we can work better, and particularly the justice system. And I really like that the same as, I know the work that Siobhan has been doing is fed into the strategy, but the voice of young people is in both the research, it informed the strategy and the key messages as well, because it has to be real and it has to, hit the audience that you want to, which is all of us as well. So thank you so much for joining us today. And we are going to welcome our final presentation. And that's from Seerling Lama from the WHO Europe. You're very welcome, Seerling. So Seerling is a technical consultant with WHO Europe, a public health professional committed to advancing health equity and sustainable urban development. Seerling specialises in integrating social determinants of health into policy. She is co-leading the Wellbeing Economy pilot. So 8 cities, of which Belfast is one of them, and we're delighted to work closely with you on that, Seerling. And the Wellbeing Economy work is committed to creating healthier, more inclusive communities. And Seerling's work is focused on supporting cities in designing policies and programmes that promote health and well-being in all. So I think this really dovetails well with the focus on ending violence against women and girls. We're very keen to hear then how the wellbeing economy can be a framework that can both include and take forward ending violence against women and girls, looking at creating safe spaces, and how that WHO framework for healthy cities can be used for Belfast, but regionally for Northern Ireland to inform the Programme for Government work. We've seen 4 of the 6 Ps included in the draft Programme for Government, and we're just keen to hear more from you today. So thank you. I know you're going to start with a message from Ciara Fortune, the focal point. So thank you, Seerling.
Thank you, Anne, for that really warm welcome. It's my pleasure to be here with you all today. So I will play Ciara's intervention. She was expected to be here, but we have a recorded intervention on her behalf. So I will play that. If the sound does not work, please feel free to chime in. Okay.
Good afternoon, colleagues, and thank you for that very warm welcome. My name is Ciara for Healthy Cities, Health Promotion and Wellbeing at the WHO Regional Office for Europe. I truly regret that I cannot be with you in person today, but I am delighted to introduce the Healthy Cities Network and its pivotal role that cities play in advancing health and wellbeing. The Healthy Cities Network is a dynamic and collaborative platform that has been active for more than 35 years, bringing together cities across Europe and beyond. Its mission is very simple yet very profound, to really place health and well-being at the center of local policies and actions. This network is not just a forum for exchanging ideas, it's a collective movement aimed at transforming the way we think about health, shaping environments that promote equity, resilience, and sustainable development. Cities are at the forefront of public health. They are where policy meets people's daily lives and where initiatives can be most impactful, whether it's through inclusive urban planning, access to green and blue spaces, or participatory budgeting. Cities have the unique ability to foster environments that support well-being and social cohesion. Now, the Healthy Cities Network emphasizes the importance of cross-sectoral collaboration and participatory approaches, ensuring that community voices are heard and integrated into decision-making. Cities can also address pressing local issues such as violence against women and girls, creating safer environments and supporting survivors through targeted policies and services. Spaces, both physical and social, are central to this vision. Safe, accessible, and inclusive public spaces contribute to mental and physical health, encourage social interactions, and promote a sense of belonging. Cities that prioritize spaces designed for people's needs, including green parks, walking paths, and community centres, create more opportunities for physical activity, relaxation, and connection. And such spaces not only improve individual well-being, but also strengthen community bonds and resilience. I'd like to recognise Belfast Healthy Cities as one of the founding cities of the network and a committed long-standing member of the WHO European Healthy Cities Network, currently advancing important work under Phase 7 from 2019 to 2025 of the network. Phase 7 focuses on 6 priorities, and these are peace, people, place, planet, prosperity, and participation. Whilst each P is essential for building a well-being economy, I'd like to highlight peace. It emphasizes policies and initiatives that promote social justice, inclusive participation, and peace, whilst actively addressing discrimination, violence, and exclusion. These guiding themes help build communities that are safer, fairer, and more welcoming for everyone. Embracing a well-being economy framework allows cities to move beyond traditional economic indicators and prioritize health, social equity, and sustainability. Cities committed to this approach, such as Belfast, as advocated by WHO's Wellbeing Economy pilot initiative, are actively investing in interventions that promote safety, accessible healthcare, environmental sustainability, and community well-being. In Wellbeing Economy cities, new sources of revenue are generated and resources are strategically redirected to support programs that promote long-term quality of life, proving that when health, social equity, and well-being become central policy goals, cities can truly support a thriving environment for all its residents. However, achieving this vision really requires addressing critical issues that impact daily life and public spaces. One pressing concern is violence against women and girls in public areas, which remains a significant barrier to freedom, safety, and access to essential services. Ending this violence is essential to building a society where everyone feels safe, respected, and included. By aligning local actions with broader well-being goals, we can create spaces where safety, health, and prosperity are a priority. As we continue to witness the evolving trends of urbanization, climate change, and social inequalities, the role of cities as champions of health and well-being becomes even more critical. Through innovative strategies, partnerships, and a commitment to equity, cities can lead the way in building healthier, more sustainable, and more inclusive futures. Thank you for your attention. Now I will pass it over to Sering for the next part of this presentation. Thank you.
So, thank you all for having us here today. As noted in Kira's intervention, my name is Sering Lama, and I'm a consultant with the WHO European Healthy Cities Network. Earlier, Kira has spoke really about the context of the European region, so I won't delve a lot into this. Folks have also shared a number of research and the numbers today in this session as well. One troubling stat that aligns with the topic of our conversation today is that 26% of women aged 15 to 49 have experienced intimate partner or sexual violence. So this means that more than 1 in 4 experience a form of gender-based violence, really signaling an urgent need and significant health issue. While you can see varying health trends with respect to mental health, urbanization, air pollution, and poverty. All of these challenges are sort of aligned with the European Program of Work at the WHO, which focuses on promoting health, equity, and well-being for everyone. I don't want to spend too much time here in terms of the overall framework, but it does help set the scene. I've heard from a number of folks of the different Ps, so it seems that the audience is well aware of the 6 Ps or 6 overarching goals that is guiding the Phase 7 programmatic cycle of the Healthy Cities Network. So that is peace, planet, place, people, participation, and prosperity. Over here, we're just showing you how the Healthy Cities Network is really a strategic vehicle in implementing these global and regional development goals, and also really delivering on these goals and targets altogether. And I'm also aware that the number of various Ps on here also align with the draft program that has been the key conversation today. So very briefly, our network was established over 35 years ago, and this was seen as a way to bring the WHO Ottawa Charter on Health Promotion from 1988 to sort of the streets or the ground level. And the idea was quickly adopted by 11 cities, one of which, again, is Belfast. So we're really pleased to be here with one of the founding cities of the Healthy Cities Network. Our reach, fast forward right now, is consistent of 81 designated cities, 22 national networks, and we reach over 1,900 cities through these networks and designated cities, and have access to over 237 million people. This really just means that the Healthy Cities Network over the last 3.5 decades have grown to its capacity, and really we function to support cities in putting health high on their agenda. And we serve different key roles and functions, one of which is acting as a platform for a knowledge exchange. For folks who are aware of our network, we have our annual business conferences where there's an image here, and this is where we come together and organize workshops and webinars. We also facilitate partnerships, so connecting cities within the region with similar challenges to share learning. But we also encourage regional and cross-regional partnerships. So here in the image, you will see a Japan study tour that was conducted where our mayors and technical experts visited a number of Japanese cities to learn more about green and blue spaces. And further, we also serve as a role in supporting cities in implementing health promoting policies. So really around policy advocacy and building technical expertise. In fact, our team has recently developed a course, that's the image you see at the bottom, on how to build a healthy city in 20 steps. And that is actually available on the openwho.org and is available for folks who are interested in learning more about how to establish a healthy city network and what that entails as well. So I would encourage you to also check that out if you are interested in learning more. So this really brings us to, Anne had kindly asked us to speak to the well-being economy component of it all and really bringing a healthy cities perspective. So as I mentioned, we have our famous annual business conferences, and in 2023, our cities and national networks adopted this political statement on advancing health in the well-being economy. The recommendations were actually drafted by the 55 cities that were present and the 19 national networks in the region as well. And in adopting them, the leaders and experts committed to championing a well-being economy for their cities and residents in addressing 4 key areas around planetary, human, economic, and social capitals. So we concluded in adopting this statement, and there's a QR code. I know Anne and other folks will share these slides with you later, but if you are interested, there's more information there as well. Like I mentioned, and Kira has acknowledged in her intervention, is that cities are drivers of innovation. And what this really means is that our cities are places where, you set the standards, you implement innovative areas of work, and it's a place for enabling an economy that works for everyone. And by that, we mean, we're thinking about the economy in a holistic way that promotes the well-being of folks and not necessarily focused on economic growth or GDP. The political statement as such focuses on these 4 key areas. You can call them capitals, petals, whatever you want. But as you can see on the diagram, they come across as unique entities such as planetary well-being, human well-being, economic well-being, and social well-being. But it's also important to note that these capitals intersect and overlap as well. So within these 4 capitals, I will briefly go over them. We have planetary, where it really focuses on protecting the environment, promoting sustainable communities, and integrating well-being into urban planning. Under the human aspect, we are prioritizing access to services and healthcare, but also recognizing that health is a beneficiary and also a driver of health and economic outcomes. Within the economic domain, we focus on promoting inclusive and economic growth, ensuring that there are health-focused practices by both public and private sectors, and boosting city investments. And in the last aspect, around social domain, we focus on fostering community involvement, trust, inclusion, embracing diversity and inclusion as well. So what does this all mean? I've went through a political statement with 12 recommendations, very high level, but it's of course, with the intention for supporting cities. So again, it is important to note that the recommendations are for local context, but based off of that too, we had to put all of this into action. So through the Wellbeing Economy pilot, which was launched last year, with the support of the European Office for Investment in Health and Development in Venice, Italy, we initiated this pilot. The aim of the pilot is really to support cities in accelerating efforts in building a well-being economy. And the pilot is currently supporting 8 cities, one of which is Belfast, of course. It's important to note here that we have noted this as a pilot because each city is in varying levels in their journey on adopting well-being economy approach. Certain cities are a little ahead, others are working towards it. And so really the goal of this process or this pilot is that we're here to support cities through an action learning journey, or that's what we've been referring to it internally. This really means that we're providing regular check-ins, capacity building workshops, and technical support tailored to their needs. So for instance, with Belfast, a technical or targeted thematic priority is around violence against women and girls. And of course, there is one key tool we're developing, and it's a self-assessment checklist to allow cities to measure their progress and to identify areas for improvement in terms of developing a well-being economy. So that is, of course, under works right now, but really through this pilot, we're trying to create a space for cities to share their experiences, to overcome challenges and make real strides towards adopting these approaches. On the screen, you will also see an example of a recent site visit, and this was in Brno, Czech Republic. And this was an example of a city-led project that was a result of participatory budgeting. And in that same vein, so participatory budgeting is also seen as a tool to implement well-being economy, and Brno is a participant of the pilot. There's a lot of text on the screen, but really it's to emphasize that Brno initiated this sort of process in 2017, and they've been going on for the last 7 years. And really the purpose of this process is to actively engage citizens in the decision-making of allocating public funds and let them decide how the portion of this budget is spent, typically at the local level. And so again, on the screen, you will see a screenshot of their website, and I'll just go next to show you what the process actually entails. So really here in Brno, what they do is folks can submit a idea, and the city will determine if it's feasible. through a feasibility assessment. If it is, then it's posted up on their website and citizens are allowed to vote. They have a set number of votes, and they can use that to vote on which projects that they would like to see implemented. And I believe the voting is currently open for this year as well. So if you're intrigued on how it works, the website is there. I heard earlier that one of the presenters spoke to about a whole of governance approach. And I do also want to emphasize that the progress that the cities are making is based on the local political commitment as well. And Philip here is our vice mayor. He's been really championing this approach within Brno, Czech Republic, and is also part of the political committee in the Healthy Cities Network. I want to share another example, but I'm not sure if time allows, Anne. It is about a minute and a half. Otherwise, I could just speak to it. Is that okay? Or should I just speak to the example on hand?
Yes, go ahead, Sterling. Yeah.
Yeah, okay. I will play the video then. So just give me a moment.
Stjórnvöld þurfa að hugsa til allra, ekki satt. Þá skiptir máli að gefa ólíkum röddum vægi. En hvert á féð að fara? Kynjuð fjármál er eitt af tólunum sem stjórnvöld nota til að geta skilyrði í fjárútlátum. Fólk er alls konar og þarfirnar alls konar. Þess vegna þarf að taka mið af þörfum alls kyns fólks áður en ákvarðanir eru teknar. Tökum dæmi. Markmið stjórnvalda á Íslandi er að minnka mengun. Þess vegna er betra að fleiri hjóli. En á Íslandi hjóla fáir og konur hjóla meir en helmingi minna en karlar. Rannsóknir hafa sýnt að konur vinna frekar nær heimilinu og sjá að mestu innkaupin og að fylgja börnum til og frá skóla. En karlar, þeir vinna almennt lengra frá heimilinu. Þeir hjóla frekar í vinna meðfram stofnliðum þar sem búið er að gera hjólabrautir. Það er hins vegar lítið hjólastiga inni í hverfunum og því oft erfitt að hjóla þar og kannski sérstaklega með börn í eftirdragi. Það er betra að hugsa þarfir alls kyns fólks í upphafi í stað þess að breyta eftir á. Fólk býr við ólíka stöðu og hefur ólíkar þarfir. Kynjuð fjármál hjálpa okkur að sjá þarfir allra. Það er bæði hagkvæmt og réttlátt.
So very quickly, as you can see in the video, in places like Reykjavik and Iceland, other tools such as gender budgeting has been used to promote equality and also embed sort of a well-being economy approach. And they've been implementing this since 2011. I wanted to share this, another tool, which is also a little similar to the participatory budgeting, as it also centers the need on how public spending is decided to account for the different needs of men, women, and other gender groups, ensuring that the resources are allocated fairly. This approach not only supports gender equality, but it also allows us to create safer, more inclusive spaces, especially taking into consideration the different needs of different folks. And also, it also plays a unique role in addressing issues such as violence against women and girls and gender-based violence in general as well. For instance, an example could this look like is that based on this gender budgeting and mainstreaming gender, we can focus on investments on a city level into transport routes that are safer, public lighting, accessible services, making the cities more safer and more inclusive and designed to support everyone. So I wanted to share this with the folks here today, just to contextualize also what a tool such as gender budgeting could do within this context. Sorry. So all of this is to say is that there's a lot of work happening at the WHO European region around the Wellbeing Economy approach. We are, of course, here in terms of the Healthy Cities Network to support our cities as well. And there's a number of resources that is available here if you are interested in learning more about this approach and what it looks like. It includes frameworks, case studies, and sort of background papers. Each of these resources provides practical tools, good practices, examples, and any sort of ideas for folks who are interested in learning more about the well-being economy. But with that, I will conclude and just want to thank Anne and every one of the partners for inviting us here today. Thank you.
Fearing, thank you so much for your presentation. I think it's always good to have, see how our policies in Northern Ireland align with WHO Europe, but also those practical interventions. So if we're thinking of that crossover, the alignment between creating safe spaces, the wellbeing economy, and examples from Reykjavik can really inform our thinking about how we take that forward. And also then the other documents that you provided, and I'll share the links to those, and also the framework that's coming that'll really guide the work around wellbeing economy and how we include that. So thank you very much for joining us today. I apologise that we have run over. I'm going to invite Louise Slevin from Programme for Government, the Executive Office, just to mention the impact assessment and how you can contribute. Thank you, Louise.
Thanks, Anne. Folks, I won't share slides. I'll just say a few words, and that's that the consultation for the PFG launched at the beginning of September, and the main draft PFG one closed on the 4th of November there, but there's still an opportunity until the 2nd of December to contribute to the consultation on our 3 impact assessments. There was an equality impact assessment, rural needs impact assessment, and a child rights impact assessment. And the basic thing is that it's a very wide-ranging programme. The ending violence against women and girls is one of 9 priorities. The missions of people, planet, prosperity, and the cross-cutting commitment to peace have been mentioned. It's a big programme, and the reality is that there will be impacts on various different groups. And we're hopeful that these will largely be positive impacts, but we really do want people's feedback on the specific areas on groups that you think might be affected. I've shared the links with the organisers, so I'm sure they can share them out, and I'll spare you my slides for now. The only other thing to mention was alongside the Programme for Government, we've also published a wellbeing dashboard, which is a selection of indicators that give a sense of well-being in Northern Ireland, and they're grouped by different domains. I might just very briefly share my screen so that you can see that website if you haven't already. Which is, just that you can go into, for example, happier children, and see a couple of indicators under it, or you could go into, any of the domains and see indicators that we hope are sort of representative of some of the things that are useful for to guide decisions going forward. If it's all right with you, Anne, I'll leave it at that and hand over to the panel discussion.
Thank you. Thanks, Louise. And I suppose it's real food for thought, the presentations today on how we can, what we should be including in the response in terms of the impact questionnaires and the assessments, and how we consider then particularly the topic around ending violence against women and girls, and how that can also be aligned to wellbeing economy, because sometimes we look at equality of opportunity and then we look at prosperity or income, and how the wellbeing economy can be a focus. And we've seen that certainly the end in violence against women and girls strategy is that taking a public health approach, and including that then to consider the impact on people's health and well-being as well. So thank you for joining us today. I really appreciate. I don't think we've time for a question and answer session with the panel. I would encourage you, I think the questions in the Q&A box have been answered. If you do have any, you can send them on to me, Anne, at belfasthealthycities.com, or contact any of the speakers directly. I will be sending out a link with the recording of today's event and the documents that were mentioned, but get in touch anytime if you need any further information. Thank you so much for joining us. I'm going to hand over to our Chief Executive, Charlene Brooks, just to close the webinar today. Thank you.
Thank you very much, Anne, for chairing the session today, and indeed for all the rest of the speakers. And I was going to say panelists, you will be aware that potentially there was an opportunity for a panel today, but we've got so much to cover within the discussion, we haven't managed to get to that. But as Anne said, if you have any questions, certainly reach out to us, and we'll be very happy to either answer them or to put you in contact with the right person. really the fact that we've even ran over and the length and breadth of the discussions today just goes to show, how important it is to reflect on the scale of this issue and the concerns that we have regarding the prevalence of violence against women and girls. Taking a well-being economy approach is going to help us really consider solutions together. So it's really important that we all bring together the relevant stakeholders, we gather the evidence, we hear the evidence, and then we work together to create solutions that work for us here in Northern Ireland. As Louise has just mentioned, now is an opportune time, given that we have this window of time to respond to the programme for government. Hopefully most of us will have put in a full response, and now we're looking at the impact assessment. And really what we're talking about at the moment is how women and girls are being disproportionately impacted by violence, and now is the time that we can contribute at a government level to really try and make changes to our society here in Northern Ireland. So as I say, it just remains to say a huge thank you to everyone who has attended today and taken time out of their busy diaries, because I very much know what that is like, and also to all of our speakers who have given their time so generously to talk about the different perspectives in relation to violence against women and girls, programme for government, and a wellbeing economy approach. So Anne and the rest of the team in Belfast Healthy Cities will be pulling together a response that we've mentioned with regards to the programme for government. We will be sharing that with attendees. So please do watch out for that, and also get in touch if you have any further questions. So thanks so much, and enjoy the rest of your afternoon.